All right, guys, I think my Wi-Fi, something happened to my Wi-Fi. Let's see if we can get it back going. Okay, is everyone up? I'm back, you guys. Sorry. I'll wait for everybody to get back up. My apologies. Welcome to Wednesday Study Live. My apologies, everyone. If you're back with us, welcome. If you're new here, I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. We meet here to complete 10 drug counselor exam practice questions. My apologies. Hey, Jessica. I'll wait for everyone. While we're waiting, I'll just give the intro again. Tonight's study questions will focus on the DSM-5 versus the ASAM. Sorry, guys. Happy to see y'all got right back in there. Please bear with me. I'm not a streaming pro yet. All right, we'll keep it moving. Let me go over question one again. Question one, what does ASAM stand for? A, Association for Substance Abuse Management. B, American Society of Addiction Medicine. C, American Substance Abuse Management. Or D, Association of Substance Abuse Medicine. What does ASAM stand for? The correct answer is B, American Society of Addiction Medicine. ASAM is a professional organization that developed the ASAM criteria, an evidence based framework used to assess individuals with substance use disorders and determine the most appropriate level of care. The ASAM criteria helps us into what does DSM stand for? A, Diagnostic Standards Manual. B, Diagnostic System of Medicine. C, Diagnostic and Statistical Manual of Mental Disorders. Or D, Diagnostic Symptoms Manual. What does DSM stand for? The correct answer is C, the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. More recently, when it was updated, added the TR, is published by the American Psychiatric Association and is the standard reference used by mental health professionals to diagnose mental health disorders, including substance use disorders. The DSM-5 outlines the diagnostic criteria, symptoms, requirements, and severity levels needed to establish a diagnosis. So the exam tip is DSM-5 equals diagnosis, ASAM criteria equals level of care. Question 3. Which statement best describes the difference between the DSM-5 and the ASAM criteria? A, the DSM-5 TR determines the appropriate level of care, while the ASAM criteria diagnoses substance use disorders. B, The DSM-5 diagnoses mental and substance use disorders, while the ASAM criteria determines the most appropriate level of care based on the client's needs. C. The DSM-5 and the ASAM criteria are interchangeable because they both determine diagnosis and treatment placement. Or D. The DSM-5 is used only for mental health disorders, while the ASAM criteria diagnose substance use disorders. Which is the most accurate, or which is accurate? Let's see what you guys say. Okay, I see some B's. Okay. The correct answer is B. The DSM-5 diagnoses mental and substance use disorders, while the ASAM criteria determines the most appropriate level of care based on the client's need. A is correct. Excuse me. B is correct because the DSM-5 answers the question, what diagnosis does the client have, or what criteria does the reported symptoms meet for the client to be diagnosed? The ASAM assessment answers, what level of treatment does the client need? A is incorrect because the roles are reversed in this answer. The DSM-5 is used to diagnose, and the ASAM criteria determines level of care. C is incorrect because they both are used in mental health, behavioral health, and substance use care, but they are not interchangeable. The DSM-5 provides diagnosis, while the ASAM criteria evaluates via 6 dimensions to recommend the client's treatment setting or level of care. And D is incorrect because the DSM-5 includes diagnostic criteria for both mental health disorders and substance use disorders. The ASAM criteria does not diagnose disorders. They determine the most appropriate level of care. So here's an exam tip to remember. A client can have a severe substance use disorder but still receive outpatient treatment if clinically appropriate. Likewise, a client with a moderate disorder may require residential treatment if the ASAM 6 dimensions indicate a higher level of care. Diagnosis alone does not determine treatment placement. So for those of you studying for the AADC, the NCAC2, or the MAC exam, your questions probably will require you to do a little bit more deeper clinical reasoning. Did I skip question 4? Sorry, guys. Question 5. Which of the following is not one of the ASAM 6 dimensions? A. Acute intoxication and withdrawal potential. B. Readiness to change. C. Recovery, living environment. Or D. Severity of substance use disorders. Which one is not an ASAM dimension? Okay. I see a D. I see C. Okay. The correct answer is D. Severity of substance use disorder is not one of the 6 ASAM dimensions. Severity is determined, the severity of a diagnosis is determined from a DSM-5 criteria based on the number of diagnostic criteria a client meets. The ASAM criteria uses 6 dimensions to determine the most appropriate level of care, not how severe the diagnosis is. A is incorrect because acute intoxication and withdrawal potential is dimension 1, and it evaluates the client's current intoxication and risk of withdrawal. B is incorrect because readiness to change is a dimension, and it is dimension 4 of the ASAM 6 dimensions, and it assesses the client's motivation and willingness to engage in treatment. And C is incorrect because recovery and living environment is dimension 6 and evaluates whether the client's home and social environment support or hinder recovery. And the ASAM recently had an update that I need to review. Question 6. According to the DSM-5, what determines the severity of a substance use disorder? A, the client's ASAM level of care. B, the type of substance being used. C, the number of diagnostic criteria the client meets within a 12-month period. Or D, the length of time the client has been using the substance. What determines the severity of a substance use disorder? Okay. See a C. See a few more C's. Okay. The correct answer is C. The number of diagnostic criteria the client meets within a 12-month period. C is correct because the DSM-5 determines the severity of a substance use disorder by the number of diagnostic criteria met within a year or during a 12-month period. So a mild substance use disorder, the client would meet 2 to 3 symptoms, moderate 4 to 5 symptoms, and severe 6 or more symptoms. A is incorrect because the ASAM criteria determines the most appropriate level of care, not the severity of diagnosis. B is incorrect because the type of substance does not determine whether a disorder is mild, moderate, or severe. Severity is based on the number of DSM-5 criteria met. And D is incorrect because although duration of use may be clinically important, the DSM-5 does not determine severity based on how long a person has used the substance. Exam tip: don't confuse a diagnosis severity with level of care. Again, a client with a severe substance use disorder may not require inpatient or residential treatment, and a client with moderate substance use disorder may need a higher level of care based on the ASAM assessment. Question 7. During the ASAM assessment, you are evaluating whether a client is currently experiencing active withdrawal symptoms. Which ASAM dimension are you assessing? A, dimension 2, B, dimension 1, C, dimension 3, or D, dimension 5? You are assessing whether they have active withdrawal symptoms. Which dimension are you assessing? The correct answer is B, Dimension 1. Dimension 1 evaluates current intoxication, withdrawal symptoms, and the client's risk of withdrawal to determine whether medical monitoring or withdrawal management is needed. A is incorrect because Dimension 2 focuses on the client's physical health and medical conditions, not withdrawal symptoms. C is incorrect because Dimension 3 assesses their emotional behavior and cognitive conditions that may affect treatment. And D is incorrect because Dimension 5 evaluates the client's risk of relapse or continued substance use after treatment. Question 8. A client meets the DSM-5 criteria for a moderate opioid use disorder. Which factor is most important when determining the appropriate ASAM level of care? A, the client's age. B, the client's score on the DSM-5. C, the client's needs across ASAM dimensions. Or D, the number of years the client has used opioids. Which factor is most important when determining the appropriate ASAM level of care? Okay. Okay. Okay, I see some B's. Let's see what else. See C. Okay. The correct answer is C, the client's needs across the ASAM 6 dimensions. C is correct because the ASAM criteria uses information gathered from the 6 dimensions to determine the safest and least restrictive level of care for each client. A is incorrect because age alone does not determine the appropriate level of care. B is incorrect because the DSM-5 establishes the diagnosis and severity but does not determine treatment placement. And D is incorrect because the length of substance use may provide helpful clinical information, but it is not the primary factor used to determine ASAM placement. Question 9. How do addiction professionals use both the DSM-5 and the ASAM criteria when working with clients? A. They use the DSM-5 to determine the diagnosis and the ASAM criteria to determine the appropriate level of care. B. They use the ASAM criteria to diagnose the substance use disorder and the DSM-5 to determine the level of care. C. They use only the DSM-5 because it provides both the diagnosis and the level of care. Or D. They use only the ASAM criteria because it includes the diagnostic criteria for substance use disorders. How do addiction professionals use both when working with clients? The correct answer is A. They use both the DSM-5 to determine the diagnosis and the ASAM criteria to determine the appropriate level of care. A is correct because addiction professionals use both together because they have two different jobs. The DSM-5 is used to diagnose, and the ASAM criteria is used for the level of care or treatment placement. B is incorrect because the ASAM criteria does not diagnose substance use disorders. C is incorrect because the DSM-5 identifies the diagnosis but does not determine where the client should receive treatment. And D is incorrect because the ASAM criteria determines the appropriate treatment setting but does not contain the diagnostic criteria for substance use disorders. Question 10. A client scores high on a substance use screening tool. What is the most appropriate next step for the addiction professional? A. Conduct a comprehensive assessment to determine whether the client meets the DSM-5 diagnostic criteria. B. Complete an ASAM assessment to determine the appropriate level of care. C. Develop an individualized treatment plan based on the screening results. Or D. Assign a provisional substance use disorder diagnosis and begin treatment. A client scores high on a substance use screening. What is the most appropriate next step? Okay, let's see what you guys put. Okay, you do the client screening. The client scores high on the screening. What is your next step? The most appropriate next step? Okay, I was trying to see the answers you guys were putting. The correct answer is A. Conduct a comprehensive assessment to determine whether the client meets the DSM-5 diagnostic criteria. A is correct because a positive screening indicates the need for further assessment. The assessment gathers detailed information to determine whether the client meets criteria for a substance use disorder. B is incorrect because an ASAM assessment is used to determine the appropriate level of care after sufficient clinical information has been gathered. C is incorrect because a treatment plan should be developed after the assessment is completed, the comprehensive assessment, and after the diagnosis is established and the client's needs have been identified. And D is incorrect because a screening tool alone does not provide enough information to assign a diagnosis. A diagnosis must be supported by a comprehensive clinical assessment using the DSM-5. So for your exam tip, I've added another layer. You must remember the order of substance use treatment, and that is screening, assessment, diagnosis, and then after the diagnosis, let's just take out ASAM. With the client, you would do the treatment plan. And all of that in that order. So as you're developing the treatment plan, you may use the ASAM assessment, and then you identify the level of care, and then you develop the goals with the treatment plan. So a screening tool is just a quick look at the most important symptoms to see if there needs to be further assessing. The comprehensive assessment is all the questions and all the information you use to see if they meet criteria for a diagnosis. Okay. ASAM versus DSM-5 key takeaways. So this is where you're synthesizing all of the foundational knowledge you have. Remember, assessment comes before diagnosis. Before you can diagnose or recommend treatment, you need to gather information through a comprehensive assessment. The DSM-5 establishes the diagnosis from the information you got from the assessment. It's the tool you use to determine whether a client meets the criteria for a substance use disorder and how severe the disorder is. You should also know the ASAM level of care. The exam expects you to recognize when outpatient or intensive outpatient or medically managed treatment or residential treatment when they are most appropriate. Don't forget the 6 dimensions. These dimensions help you evaluate the client's overall needs, their risks, their strengths to determine the safest and least restrictive treatment setting. Always match treatment to the client's needs, not just to their diagnosis. 2 clients with the same diagnosis may require completely different levels of care based on the ASAM assessment. So a diagnosis does not determine placement. Now remember, this is for the exam, guys. Some of us work in the field and it may seem like the diagnosis drives everything. But remember, on the exam, we're in a perfect world. The diagnosis does not determine placement all the time. The DSM-5 just tells you what areas or what diagnosis the clients have, what functional impairments the client has. The ASAM criteria helps determine what the client needs. Finally, we use both as addiction professionals, and we need to understand both to serve our clients or to treat our clients. Together, they help us as addiction professionals make accurate diagnosis. It helps us recommend appropriate levels of care and also to develop person-centered, individualized treatment plans. Okay, let's get back. All right. So we have a few minutes. I thought I saw someone say they're taking their exam this week. Best wishes to you. Please keep us updated. We're going to go back to since we have a few more minutes, I'm going to go back to okay. That is the new cover, I believe. I have the older cover. If you have any questions, you can put them in the chat, guys. I'm going to be up here until 8 o'clock. So I'm going to come from the old ASAM. I think there were a few changes under the new. Maybe I'll go over that next week. Why is my chat frozen? Oh, sorry, guys. Best wishes to you, Zach. Make sure you try to study in a quiet area. And that a little bit of anxiousness is good, but hopefully it doesn't overwhelm you too much. Congratulations, Jessica. Thank you, LaJohn. LaJohn says thanks and great group. Enjoyed it tonight. Getting a lot of insight. Thank you. Congratulations to you, Jessica. Jessica says, I passed my ADC exam last Friday. Go, Jessica. Go, Jessica. Congratulations. And to go back to managing anxiousness, testing in a quiet area, like truly as close to the exam setting as possible. So for those of you who've taken credentialing exams, certification exams, you know how quiet and cold it can be in there, and so tense, and other people are in there taking their exams and all of the rules, and put your keys up and don't look around. That just drives me. That just sends me because it makes me remember how important it is. So sitting in a quiet area, go to the library. If you can't leave the house, maybe see if you can get 1 to 2 hours where you do practice questions just quietly. Or see if you can get the 100 question practice exam on my stand store. Print that out and go in a quiet area and see how long you can go. And I'm glad we're talking about this. And thank you guys for joining. If you have to go, I'm just gonna ramble a little bit because we have a little bit of time. Thank you so much for joining us. I'll see you guys next week for those of you who can't stay around. For August, these Wednesday night lives are going to be from 6 to 9. I'm going to start doing the extended session for August because September is recovery month. So I want to have all of those extended videos already up. I was going to do it in recovery month, but I'm going to do it in August. So I'll remind you for the next couple weeks, every Wednesday in August will be the extended session. So I'm doing the extended session for 2 reasons. So you can see how long 3 hours is. Now, for those of you who have already taken the test, you know 3 hours can be kind of long. But if you've never taken a certification exam or a licensure exam, most of our tests have 150 questions and they give you 3 hours. I feel like sometimes we overstudy, but we forget the environment part. So some of us, we're ready, but our nerves get the best of us. So if you can join us for all 3 hours, please, but still log on. If you can't do the 3 hours, just log on at 7 like you usually do. We'll do a separate topic, the 6 o'clock hour, then the 7 o'clock hour, then the 8 o'clock hour. And it'll just be like 3 study sessions in one. Because I want you guys to have an opportunity to answer questions for 2-3 hours, and maybe that'll help. Now, of course, I'm narrating, so that's the difference, but we can start there. You're welcome, Jessica. Thank you for supporting the channel, and congratulations again. So yeah, so some anxiousness is good because it reminds you that you care, but too much anxiousness and intense anxiety can throw us off. Oh, let me get back to the dimensions. I'm going to go over all three dimensions. I mean, all. And the level of care. Okay, dimension 1. Acute intoxication and or withdrawal potential. So for ASAM, dimension 1, you're looking to see if they have any withdrawal risk. Thank you guys. Thank you guys. I'm just going to be chatting, going over just a few extra details since we finished early today. Thank you guys so much for joining if you have to go. Now I have to purchase the new one, but let me turn the camera on so I can show you guys how helpful the ASAM book is. For those of you who didn't know, I currently conduct substance use assessments for court-related issues, and my ASAM book is my best friend because everyone is different. So you want to tailor the person's level of care to their specific needs. Let me turn back on the camera so you guys can see the old book. Okay. So this is the 3rd edition. I need to get the new edition. But this is how this chart, they have a chart where you can go through each dimension and it will give you guidance on the level of care. So again, don't become overwhelmed when you're taking your certifications because you're basically going to be a lifelong learner because you can't memorize the DSM-5 and the ASAM. But you do need to know the foundational knowledge, but you always keep your books with you. So let's go over the dimensions. Dimension 1, acute intoxication. Dimension 2, medical issues or biomedical conditions and complications. Dimension 3, emotional behavior and cognitive conditions and complications. The way I remember it, Dimension 1, withdrawal. Dimension 2, medical. Dimension 3, mental health. Dimension 4, readiness for change. Dimension 5, relapse potential, but the actual title is relapse, continued use, or continued problem potential. And then dimension 6 is recovery/living environment. I do understand there are some updates in the new one. I glimpsed over the new edition. They've added a lot of cultural components and factors that we should consider as addiction professionals. And then the levels of care are on the left-hand side. Level 0.5, early intervention. So that would be like psychoeducation, drug classes for someone who is using or have problematic use but does not need a higher level of care, or they don't meet criteria for if you did the full assessment with the DSM-5, they don't meet criteria for a substance use disorder, but their behavior is high risk. So usually 0.5 would be someone who has used or their use is escalating. Level 1, outpatient services. Level 2.1, intensive outpatient services. Level 2.5, partial hospitalization. Level 3.1, clinically managed low intensity residential services. Level 3.5, clinically managed medium intensity residential services. Level 3.7, medically monitored high intensity inpatient services. And level 4, medically managed intensive inpatient services. So as you can see at the top, so when you're working with a client, you can go to each dimension and it'll tell you the recommended level of care. So if you're working with a client, they have no withdrawal risk, you will go down to the level and they'll either be a 0.5 or a level 1. And you would distinguish between what level they have from your assessment or the information they give you. And that's where your clinical knowledge comes in and your clinical reasoning comes in. Okay. Let me go back to the chat. Yes, Doreen, did they change 4? Substance use related risk? I'm going to have to purchase the new one. I have a PDF. I should look it up now. Doreen says D4 changed to substance use related risk, and 5 is now 6, and D6 is person centered. Okay. Let me see if I can pull up. I had did a whole presentation maybe 6 weeks ago, and as soon as I got finished, I said, you know what? This is off-dated information, and I scrapped it. I was like, all that work for nothing. That's what I get for rushing. Let me see. ASAM changes. So yeah, it was due for a change because this edition came out 2013 and the new one came out in 2023. So I'm going to be posting polls on the community post to see what topics you want for the extended sessions. Again, for those of you who are just logging in or didn't catch it a few minutes ago, in August, every Wednesday, I'll be starting at 6. We'll have an extended study session, 6 to 9, for every Wednesday in August. And we'll have a different topic each hour. So it'll be like having 3 study sessions in one. So it's one to give people who can't join weekly an opportunity to join just for one extended session, but also to give you opportunity to sit for a couple hours just for those of you who are gearing up for your certification exams. So definitely going to have pharmacology, and pharmacology is probably going to be broken down into 4 topics. So there's probably going to be a pharmacology topic every week. So let's say maybe the 6 o'clock hour will always be pharmacology, a subtopic of pharmacology. And then I'll have you guys select a poll this month when I post on the community post, and you guys tell me based off what you guys select, those will be the other topics. So we'll have pharmacology at the 6 o'clock hour. Then we might do counseling skills at the 7 o'clock hour. And then at the 8 o'clock hour, we may do ethics. you passed? Brenda, did you pass the ADC or the AADC? Which exam were you testing for? Congratulations to you. I'm happy. I love when you guys are like, I passed my test. Let me wait. It's a little delayed. Congratulations, Brenda. Okay, Doreen. Thank you so much for supporting the channel. Congratulations, Brenda. Everyone say congratulations to Brenda. She passed her ADC. Congratulations to you and best wishes on all your endeavors, Brenda. Thank you so much for supporting the channel and for updating us. Thank you so much. I appreciate you. Brenda says, and it was because of these videos. I appreciate you. Thank you so much. I'm so happy that it's helpful. Congratulations again, Brenda. Please make sure you update our study partners who are not on the live by choosing any video. Choose one of your favorite videos or a video on the channel that helped you the most and just update us, please, if you feel comfortable with that. That really helps us and motivates the other study partners. Congratulations again. Okay, guys, we've made it to 8 o'clock. As usual, thank you so much for being a part of this learning community. I appreciate you for supporting the channel. Please like this video and make sure you're subscribed so other study partners can find us. I will see you guys next week. Be on the lookout for the community post where I'll be getting your opinion on what topics you want to study for, what topics you're most interested in for the extended sessions I'm going to do in August. Good night, everyone, and thank you. And congratulations again, Jessica and Brenda. Congratulations to you both. Good night, everybody.